Hello, Lydia.
Hi, welcome back from the break. My name is Dr. Lydia Latreris. I am the coordinator of the Prevalence Reduction Innovation Forum and an associate research scientist in the School of Social Work at the University of Georgia. I'm also a member of the African Programming and Research Initiative to End Slavery at the University of Georgia. So we're getting ready to hear from an impressive group of researchers who are leaders in their field. Our team at the University of Georgia will be coordinating the work of these research teams as they develop and implement their strategies. And what we'll be doing is making sure that their work is done in parallel and in accord with one another. This means coordination in terms of developing and using the same definitions and indicators of human trafficking, using common estimates, and using common standards. We know that having siloed information and using different measures and definitions has been a significant limitation in this field, so our forum plans to overcome this challenge. Our ultimate goal is to test and share the best methods, and we hope to do that and share our findings in another conference 2 years from now, and hopefully that one will be done in person. We will be supporting the teams as they develop and implement their research strategies and collaborate with local partners in the countries in which they are conducting their research. All of the research teams are especially sensitive to safeguarding the individuals and the communities in their studies, and their plans will be carefully designed to increase access to their population of interest, while also being mindful to not be extractive and to minimize risk of harm. While many of you here are not methodologists or statisticians, we hope by now it is clear that having good prevalence estimates is crucial, as it has significant implications for prioritizing resources, for policy and programming, and for evaluating the effectiveness of interventions. I would like to take a moment before we get started to thank all of the individuals who have spent countless hours reviewing the proposals from our applicants, as well as everyone who helped to put this event together today. Thank you also to the Office to Monitor and Combat Trafficking in Persons for providing the funding for this exciting opportunity. Before I hand it off to the first research team, I want to remind you about the Q&A feature at the bottom of your Zoom. This is where you should address questions through panelists, and we will address them after all of the research teams have presented. If you're joining us on Facebook Live, please leave a comment in the Facebook Live link that you're watching. And if you'd like to use Twitter, just make sure to include the hashtag Prevalence Forum in your tweet. Now we're getting ready to start with our first team. That is from the Freedom Fund, and we will hear from Deborah Arana and Yuki Lowe. Over to you, Deborah.
Okay, thank you, Lydia. Good morning, everyone. First of all, thank you all. Thank you especially the University of Georgia and the U.S. State Department for commissioning these important studies. I'm the Freedom Fund advisor for Brazil, and I have been working as an expert in human trafficking for the past 15 years here in the field, and also advising international agencies, local governments, NGOs, and presiding the anti-trafficking movement here. So I'm very excited to take part in this unique research. It will be very valuable, not just for the research community, and also, for practitioners like myself, and really address a major gap in the fight against human trafficking. So our research proposes to shed light on the invisible victims of sex trafficking of children in Brazil. I'm going to ask you to present, please, the first slide. Okay, thank you. So Brazil is a major source and destination country for human trafficking, especially of children and women for sexual exploitation purposes, as many of you might know. It's also believed to be the second country with the highest prevalence of child sex trafficking. And there are several estimates ranging from 100,000 to 500,000 child victims of this serious crime. But those are very unreliable estimates and outdated numbers, and the real size of the problem is really unknown to all of us. And this is preventing a more effective response from the Brazilian government. This is a problem that is driven by a complex combination of factors, cultural, socioeconomic factors. There's poverty and sexism at the center of it. Social norms like child marriage contribute to keep this a socially accepted practice. So the result is that there are few cases reported to authorities, and there is a huge silence around child trafficking in Brazil. The victims usually come from the poorest communities, and Black girls and indigenous girls in the Amazons are even more vulnerable to be trafficked. There are many ways that children will fall victims of traffickers. Sometimes in extreme poverty, they might be used to trade sex for food and for other goods for their families. In larger cities, they might be seduced into exchanging sexual dates for gifts, things like shoes, gloves, parties, small sums of money. Some of them will receive invitations and promises for a better life and will leave their communities and end up in the streets, exploited or trapped in trafficking networks. In rural areas, children are exploited in farms, mining areas, and around big construction sites. They can also be found in highways all over the country, in boats, in rivers, in the Amazon. There's many ways that this horrible crime is happening with children all ages in Brazil, especially teenagers. In the northeast of the country, historically the area with most child trafficking reports, sex tourism is a major problem in beaches, in resorts, in the coast, and it happens with the help of local residents and informal businesses. The largest city, Recife, has the highest rate of children living below the poverty line, and it is also home to the NGOs that started the anti-trafficking movement in Brazil, which makes this city ideal for our study. Unfortunately, the city right now is very much affected by the coronavirus and is in partial lockdown, but we hope to be able to start as soon as the situation allows. Unfortunately, thousands of families have lost their sources of income and they're being hardly hit by the economic impacts. So there is growing concern that this will also increase the trafficking of children. And as these challenges increase, this research has become even more important. So I will pass for my friend, my colleague Yuki, for the next slides. Thank you very much.
Hi, I'm Yuki. I'm head of research and evaluation at the Freedom Fund. And my friend and colleague, Deborah, has just outlined why we need a more precise measure. And I'm now going to get a little bit more nerdy about how we intend to measure this very hidden and troubling phenomenon. So one main purpose behind all the PRIF grants is to compare to quantitative methods. And the challenge with our study, as well as with some of the other studies, will be that we just don't have a sampling frame, which often is the bedrock of any statistical sampling. So unlike the census, where you have a known list of households in one city, in Recife, we don't have a list of sex workers. So we then have to rely on using other specialist methods. And in our study, we are proposing to use respondent-driven sampling as well as time location sampling. So the first one, RDS, relies on referral amongst the target population. And in our case, we will be recruiting adult female sex workers into our study. And I'll explain why in a minute. So what we'll do is start with a set number of seeds who are themselves adult female sex workers and have them refer other peers and then refer other peers. But unlike convenience sampling, we then statistically adjust for each respondent's network size and characteristics in order to derive a probabilistic estimate. In contrast, the second method we plan to use is time location sampling. And as the name implies, it draws on a listing of locations where sex workers are likely to be found. So for example, in certain bars, hotels, sexual health clinics, certain streets, bus terminals, as well as, of course, online platforms, which will become more of a norm post-COVID. We then randomly draw from this list of locations at random time intervals and then send surveyors in to select people at random intervals for surveying. And both respondent-driven sampling and time location sampling are typically the most used methods for estimating hidden population. But of course, there are important limitations. So the first and foremost in our study is that we are relying on an indirect measure. We have to do this because we had to work around the mandatory reporting requirements in Brazil. And essentially it means that we are asking adult sex workers to report on the number of other sex workers that they know, as well as among that, how many might be children. So in essence, we are relying on the recollection of adult sex workers, which will of course introduce an extra layer of error into our study. Secondly, and I think as David alluded to before, this is a highly stigmatized population. People don't necessarily want to come forward and self-identify as a sex worker. So it's important for us to recognize that even though we might be at the right location at the right time and have very friendly data collectors, people will still refuse to participate in the study. And thirdly, even if we were able to address the above points, I think that we have to acknowledge that we can never design a method that reaches all pockets of the sex worker population. So there'll always be individuals who perhaps are in very unique settings, maybe some people who don't solicit and only work with a handful of exclusive clients, or on the other end of the spectrum, there might be people who are forcibly kept in isolated circumstance. So with these two methods, we'll of course try our best, but we need to acknowledge that there will always be certain types of individuals that will be undersampling and missing from the study. And lastly, something that's on top of all of our minds, COVID is going to change the type of people who do sex work as well as the nature of the work itself. So I think we need to acknowledge that this study will capture the prevalence at one point in time, but it's a very unique situation at the moment, and the nature of sex trafficking might well change rapidly afterwards. So that's all to say that this study will be an attempt to get closer to the true scale of child sex trafficking, but it's unlikely that we'll ever have the exact true figure. Next slide, please. So that all sounds like a lot of work. What will we get at the end of it? So first and foremost, we're very interested in knowing what the prevalence rate is. So that is among a population of, say, 1,000 female sex workers, roughly how many of them would be girls aged 17 and under. Now, of course, the study will provide much more information than just a prevalence rate. We will have information on the type of locations where we're more likely to find children. We'll also understand a lot more about the forms of exploitation that these victims are subjected to. So of course there's sexual exploitation, but we also know that there'll be physical violence, emotional abuse, and financial coercion involved. And we need to know that to inform policies and programs. And secondly, of course, as all my predecessors have mentioned, we want to assess the strengths and limitations between two methods and know, for example, if one might be better at reaching more marginalized population, or perhaps one might be better at encouraging disclosures and honest results, honest reporting than another. And of course, ultimately, we're not just doing research for the sake of it. We want to have impact through this research. And sort of one of Freedom Fund's motivation for being involved in this, this group of study is because we really want to have the results so that we can use it to inform our own anti-trafficking program. But on top of that, we're really keen to share the results with other NGO partners so that we all have more credible evidence to advocate for more effective policies to the government and help reduce the number of children being trafficked for sex. And on a global level, we're of course really keen to be part of this PRIF family and to be adding our results to strengthen the rigor of anti-trafficking research. And finally, just to say, as Deborah mentioned, I think Brazil and in particular Recife is experiencing very high rates of cases and death as a result of coronavirus. So this is not our plan at the moment, but we are operating under very uncertain circumstances. But eventually, we do hope that in 2 years' time, we'll be able to come back together, share what we've found about child sex trafficking, as well as what we've learned through this process to help inform further studies. Thank you.
Thank you so much, Freedom Fund. You've noticed that we will be putting up polls at the end of each presentation asking which method you think will return the best estimate in the specific context. All right, so next we have Stanford University, and we will be hearing from Dr. Grant Miller and Dr. Kim Babiars.
So good morning, everyone, or good afternoon or evening. Let's just move right to the first slide, if that's okay. So we are really delighted to join you all here today. And very briefly, we really want to express our gratitude to the sponsors and organizers, as well as all of you who are so committed to this work generally. By way of very brief background, just at the outset, I just wanted to tell you that the Stanford Human Trafficking Data Lab is a group that we've recently created at Stanford to focus expertise from all across the university on issues of human trafficking in collaboration with those having frontline and public policy experience. And our focus is really twofold, both to expand the technical knowledge base of evidence on trafficking and also to inform and sharpen policy with it. We've begun our work through partnerships in Brazil, and our hope is that it will really be a demonstration more generally of what can be accomplished in part with data that already exists, simply by creating linkages across administrative data sets, including across agencies at the level of individuals, which we think is really important. And then using advanced methods for analysis that are really the bread and butter of what academics do. And given that this is a group here today formed around innovation and prevalence reduction, I thought I'd quickly mention 3 areas of current research. The first is work to use these new data resources to build machine learning models, culminating in the creation of a new decision support tool to aid Brazilian labor inspectors and federal prosecutors in their work to combat trafficking, and then to go out and actually rigorously test the real world impact of the tool. The second analyzes the financial impact of what's called Brazil's dirty list for companies found to be violating labor trafficking laws. And importantly, it also analyzes how companies are able to evade the dirty list's otherwise intended financial consequences. And the third current area of work uses rigorous observational study designs to isolate how Brazil's major social programs, including ones like Bolsa Familia, which is the country's flagship conditional cash transfer program, are influencing not only vulnerability to trafficking, but ultimately victimization. I should say that we've been very careful to design all of this work in a way that largely doesn't subject it to biases due to not knowing the true underlying prevalence of trafficking in Brazil. But measuring and knowing the underlying prevalence of trafficking is also a really critical deficit in the knowledge base, which is why we're so excited to be part of and to learn from this group. So with that, I'm going to turn things over to Kim Babiars, who's another member of our Stanford lab, and she's going to tell you about our planned prevalence measurement work in Brazil's agricultural sector.
Thanks very much, Grant. So as Grant mentioned, we are going to be joining the Freedom Fund in looking at Brazil. And Brazil is a country with extensive and deeply entrenched trafficking networks that are occurring both in markets for sex as well as markets for labor. In the past 15 years, Brazil's labor inspection task forces have uncovered close to 50,000 victims of labor trafficking. And the best estimates that we have currently place the number of trafficking victims at any one point in time around 370,000, or about 1.8 per thousand population. Of course, these estimates are quite outdated and very limited. So our goal is to produce some better estimates and specifically focusing on the agricultural sector. We also believe, importantly, that Brazil represents a unique opportunity to leverage new evidence on patterns of labor trafficking for both rigorous academic research as well as meaningful policy action. In particular, as Grant mentioned, Brazil has data transparency laws that mean that any data that we have on human trafficking can actually be paired with large pools of administrative and program data to enable quantitative research on the causal factors driving trafficking. So we can actually use prevalence estimation as an opportunity to also deepen our quantitative knowledge base on trafficking. We also believe that there's real opportunity for translating this research into policy improvement, particularly when it comes to policies to protect laborers. There are lots of examples of local leaders seeking in good faith to create evidence-based policy to fight human trafficking in their areas, and long-time cooperation between federal and state law enforcement agencies in the formation of anti-trafficking task force. So we think that there's a real opportunity here to translate this research into actual action on the ground. And to this end, we're focused on measuring and understanding patterns of labor trafficking in the agriculture sector specifically, which we believe accounts for the vast majority of labor trafficking cases in Brazil. Okay, next slide. According to the best sources of the existing data, and these are data on detected cases, close to 80% of labor trafficking victims are found in agriculture. This is happening largely in cattle ranching, sugarcane production, rice cultivation, tea, coffee, other crops. And we believe that the short-term seasonal nature of these job contracts, the lack of any formality in the job contracts, third-party recruitment practices, and the very remote working locations all contribute to the problem in agriculture in Brazil. Next slide. So our project has 4 main objectives. First, of course, is we seek to make an accurate prevalence estimate using a method as close as possible to a gold standard. So using a nationally representative survey that is representative of the agriculture sector. Second, we will compare these estimates from survey respondents' own experiences to estimates made using network scale-up approach among the same sample of individuals. So because we're using the same respondents to make both estimates among the same target population, we'll have a very apples to apples comparison of prevalence rates implied by either approach. Third, we want to compare the survey-based estimates to the most comprehensive available list of known victims. And this will give us some vital information on the blind spots inherent in detected case lists. And finally, we want to compare estimates implied by alternative definitions of labor trafficking. So looking at the Brazilian legal code compared to the international standard, for example. Okay, next slide. So as some others have mentioned, making prevalence estimates representative of a target population is not a straightforward task. Our plan is to use an enriched cluster random sample design. And one of the most difficult technical obstacles is often establishing a sample frame comprising the entire universe of potential victims. We plan to take advantage of the extensive reach of Brazil's ubiquitous CadÚnico data frame for this task. CadÚnico is an administrative registry that households are required to file into in order to receive any number of social programs that might be available to them. And that includes the COVID-19 related economic relief program, COVID Pay. This registry is enormous and it's very well established in Brazil. And it is thought to be a near complete listing of households in our target socioeconomic class. Our most recent look at CadÚnico shows that there are 27.5 million unique households in all 5,570 municipios. Okay, so I'm being told I have 2 minutes left. So I'm just gonna skip some of these details and let you know that we have the ability to actually pre-screen these households to identify where the agricultural workers are. This is how we're gonna find people. And we are going to draw a random sample of 300 clusters, about 20 to 25 households per cluster, aiming for a total sample size of about 7,000 households. Okay, next slide. So our benchmark estimate is going to be based on this household survey administered to our random sample. We'll follow the family life survey model to ask respondents a series of work history modules for each job contract they've worked in the past couple of years. So this is covering the seasonality of agricultural work. These modules will be designed to ask a sequence of questions about the basic characteristics of each job, and also, importantly, the elements that are required to establish trafficking according to a variety of standards. So then we can make a determination of trafficking status after the data collection. Cluster level prevalence is then straightforward, and we can scale up to recover sector representative prevalence estimates. Okay, next slide. So we'll then calculate a second measure of prevalence, which is a network-based estimate. We have a naive approach, which I'll skip over in the interest of time, and look at the more formal approach, which uses the generalized network scale-up methodology. This requires collecting information on what are called out reports, or the number of trafficking victims that each individual in our survey is aware of. And that uses a straightforward set of questions. And then we will also collect what's known as in-reports, which can be thought of as a measure of visibility. And that will be collected among trafficking victims only. And we can use a pre-programmed set of criteria in handheld survey devices to determine likely trafficking status in real time to identify those for whom the visibility module is required. Okay, next slide. So just to wrap up, some of the analyses that we are really excited to look at following this data collection include, of course, comparing survey-based estimates to network scale-up estimates, and we'll be working with the research group to align this comparison with all of the other teams. Second, we're going to be very interested in comparing the patterns of trafficking that are implied by our survey to the patterns that are implied in the most comprehensive possible list of known cases. So these are coming from police reports, labor inspection reports, administrative caches, and frontline workers. And so far we have a list of over 40,000 trafficking victims. So we want to understand how representative are those lists of detected cases, even when they're the most comprehensive list possible. Where are the blind spots? What are the socioeconomic, demographic dimensions along which those diverge? Third, we'll construct prevalence estimates using slightly different alternative definitions of trafficking to understand the implications of adopting different legal standards. And we want to look to understand the dominant modalities of trafficking. So what are the means by which individuals are being held in forced labor? And we want to understand labor practices as they exist on a spectrum of exploitation. So some practices which might approach but not quite meet the definition of trafficking. We want to understand all of those dynamics through detailed information that we collect in our work history modules. That's it.
Thank you very much. Just heard from Stanford University.
That shows our whole research team, but I think we can just.
Oh, here you go. Yes, yes.
Yeah, and
yes.
we have our.
Would you like to? Yes.
Listed there. We're so fortunate to work with these people, but we can keep going to the next group.
Thank you so much. You can see the whole team at Stanford University. It's a large group of impressive people. You'll also have noticed the polls. You can continue the discussion in the chat on the polls that arrives at the end of each presentation. Next, we will hear from John Jay College of Criminal Justice, and presenting will be Dr. Meredith Dank.
Good morning, everybody from Brooklyn, New York. Thank you, Lydia, for the introduction, and thank you very much to the University of Georgia and to the U.S. Department of State's JHSPH office for providing an opportunity to do an in-depth look at prevalence. Having worked in the field of human trafficking for over 15 years now, prevalence is something that has come up time and time again. So to have the opportunity to explore and look at various methodologies to see what works, knowing that there isn't probably one methodology that will work for every population, is a really exciting opportunity. And here at John Jay College, we're incredibly excited to have won 2 projects under this program. And so I'm going to, for the sake of time, explain a little bit about each project, the populations and the countries that we're focused on, but I will spare you and only explain the methodologies that we'll be using once. So to go to the next slide, the analysis is only good as the data that we're able to collect. So I want to make sure that I'm giving proper due to the fabulous research teams that we have for both projects. So for the first study, we'll be estimating the prevalence of forced labor in the fishing industry on the Pacific Coast in Costa Rica. We'll be working with the International Organization for Migration, IOM, and that team will be led by Francesca Tabellini and Kristen Edwards. And my co-investigator, a name that you've already heard and you will hear several other times during the course of these presentations, Dr. Sheldon Zhang at the University of Massachusetts Lowell. Leading the statistics part of this and the analysis is the incomparable Dr. Kyle Vincent, who you will also hear several times throughout the course of these presentations, and assisting him as a statistics advisor, somebody who has done a lot of work throughout his career is Professor Steve Thompson. If you want to go to the next slide. So the other study that we'll be looking at is estimating the prevalence of forced trafficking among domestic workers in 3 locations within Tanzania. I want to point out that we'll be looking specifically, as I'll describe a little bit more, domestic workers who have worked abroad and returned back to Tanzania. We will not be looking at domestic workers who work within the country of Tanzania. Again, we have a fabulous team, which we wouldn't be able to do any of these projects without. Again, my co-investigator will be Dr. Sheldon Zhang at the University of Massachusetts Lowell, but we'll also be working with the Community Health and Social Welfare Africa, who is led by Faraha Dimitrios. I believe I said hello in the chat, so I know he's part of this. Dr. Kyle Vincent and Professor Steve Thompson will also be leading the statistical analyses part of this project as well. And then this particular project wouldn't happen without our country consultant, Dr. Amana Mbisi. I'm gonna go to the next slide. So a little bit of background and rationale, particularly with the project starting in Costa Rica. So for those of you who may or may not be familiar with the fishing sector there, it is comprised predominantly of artisanal fishing on the Pacific coast. And it is also highly decentralized. Fisheries are an essential source of labor in coastal areas where there are high rates of unemployment. And not only in Costa Rica, but as we've heard in many parts across the world, there are many risks of exploitation in the fishing industry. But particular to Costa Rica, due to the decentralization, there's a particular lack of oversight to ensure appropriate labor standards, and there are few avenues for recourse in the case of abuse. Particularly what is important to note is that there's only a few studies out there that have looked at the fishing sector. There is actually a study that will be coming out soon, I believe through ILO, looking particularly at women who work in the fishing sector in Costa Rica and the rates of exploitation there. But we really don't have an overall sense of what that might look like in Costa Rica. Because we're not focusing on the whole country, but on a specific part of the country, we will be looking at the Gulf of Nicoya. And similar to everybody else, we will be using 2 population sampling strategies and corresponding inference procedures to produce population estimators. We are lucky in both studies that we do have some administrative data that we can use as our sampling frame. IOM luckily has access to a complete roster of all major fishing councils and associations and works closely with a lot of these places. So we'll be able to map out where the fishermen reside and where they work in order to be able to sample accurately or more accurately as to where we might be able to find them. Go to the next slide. For Tanzania, we are focused specifically again on domestic workers who have worked abroad. In recent years, there have been growing recognition of the increasing scale of transnational trafficking for domestic servitude involving Tanzanian citizens, primarily women. According to the Tanzanian police, the majority of victims are reported to be destined for Oman, Pakistan, and India. However, as some of you might know, there have been a lot of media reports recently also of Tanzanian women who are brought into domestic servitude in other Middle Eastern and Asian countries. The study seeks to estimate the prevalence of labor trafficking among Tanzanian domestic workers who work abroad by, again, using 2 population sampling strategies, the same as the one we'll be using in Costa Rica. And data collection will focus on 3 source and destination hotspots in Tanzania for sending individuals abroad and for domestic work. And those are Iringa, Dar es Salaam, and Zanzibar. We are very pleased and excited and privileged that the Tanzanian national government, particularly the Secretariat for Anti-Trafficking there, has endorsed our study and will provide various administrative data to the team to serve as the foundation of the sampling frame. As I had mentioned in the beginning of this, we will be using the same 2 study methodologies. And a big piece to this is, the questions that I think have come up in the introductions and in people's various talks is, will 1 or 2 sampling methodologies work for very different populations, even subpopulations in very different countries. So what we're hoping to see is if that is actually the case. So will methodologies that work on estimating people who are exploited in the fishing sector in Costa Rica also work for finding the estimate for the number of individuals who are brought into domestic servitude abroad in Tanzania? So the two methodologies that we've chosen to use to measure this are probability-based sampling, which I know we've heard a little bit about and we'll continue to hear. Everyone's going to be an expert on PPS by the end of it if you aren't already. And RDS, which it seems that a lot of people are very familiar with. But we will be looking specifically at a more enhanced RDS version, what we call RDS Plus, which is a multi-wave snowball sampling. You know, a big piece, as I'd mentioned before, of using the same two methodologies on two different populations in two different countries is to test the generalizability of these two methods. Another big piece to this is to train local researchers on how to implement innovative sampling strategies with the hope that they will then be able to take this knowledge and take these methodologies and apply it to other populations within their countries that are suffering from different types of trafficking. So a little bit about probability-based sampling. We'll be looking specifically at multi-stage PPS sampling. As I had mentioned before, luckily, we have clearly defined sampling frames that we can work from for both populations in Costa Rica and Tanzania with reasonable geographic boundaries. Again, we're focused on 3 locations in Tanzania and the Pacific Coast in Costa Rica. PPS is arguably the most used data collection method in social science research, particularly when it comes to estimation. And this method will serve as a point of reference for comparison purposes. As I'll talk a little bit more, there are obvious limitations to using something like PPS, which is essentially going door to door and asking the list of survey questions of either the head of household or somebody who would represent the population that we're seeking, which can be problematic for various reasons, which I'll talk about in a second. I want to go to the next. So respondent-driven sampling plus, again, it being a multi-wave snowball sampling. For both, we will have administrative data for both populations. And then from this data, we will select a relative large number of seeds or entry points. And so these are typically people who represent different parts of the subpopulations that we're interested in looking at. So for example, in the fishing sector, we will make sure to get a number of different seeds that represent people who might have migrated from other countries, surrounding countries, women, men, minors, and adults. And we're going to make sure that those seeds are spread out over a well-dispersed geographical area, as I mentioned, with different demographic profiles. Depending, which I will talk on the next slide, as to when we start both of these different methodologies. If we start PPS first, we'll be able to identify some good seeds from the household survey, from which then the snowballing will happen. And I think Yuki from the Freedom Fund showed a really good visual as to what that snowball sampling would look like. Unlike traditional RDS, which typically starts with a small number of seeds or entry points, and then has many, many waves of referrals after that, we're going to actually start with a larger initial sample, so more seeds. So it's more representative of the hidden population, and it only allows for a few waves of sampling. So that way we can even reduce homophily even more that way. The aim is to sample wide rather than deep, again, to achieve a more representative sample of the hidden population. Next slide. So for field procedures, as we've all discussed, this is an incredibly vulnerable and sensitive, both are vulnerable and sensitive populations. So we will make sure to get all the necessary approvals from the John Jay College Institutional Review Board. We will then train the local staff on data collection and all those ethical procedures, which there will be plenty. And from that, we will conduct a pilot study to field test the survey instrument. And that will ensure that we are asking the right questions to get at what we need to be able to do the estimate, make any tweaks based on that, but also get a sense of where PPS and RDS Plus might work best. We will then construct a list of all the communities where the fishermen reside on the Pacific Coast in Costa Rica and where the domestic workers live in the 3 locales in Tanzania for our primary sampling units. Following a random PPS sample, which the other presenters had talked a little bit about. Again, going door to door, finding where people reside. We will sample clusters of villages before conducting a systematic recruitment approach based on the number of interviews allocated for that location. The aim is to conduct 1,000 surveys. So we will sample from obviously a much larger pool through the multi-stage PPS. And then based on results from the pilot study, as I mentioned before, we will either wait a month or so to begin the RDS Plus data collection. And this is, again, there are a lot of factors that we talked about: COVID, movement, particularly with both populations, you know, people going out to sea to fish for, you know, what could be very long amounts of time, and then for domestic workers who might be going back abroad to work elsewhere. As we've stated, unemployment rates are pretty high, so there might be a lot of migration that ends up happening that we'll have to account for when it comes to, you know, looking for employment. So that might mean that we have to run both data collection efforts concurrently. We will select the seeds as described in the previous slide, and then we will set up shop in order to be able to account for all the referrals that come in for RDS Plus. We will need at least a couple of weeks in each hotspot to be able to get out all the referrals. And we will also aim to get 1,000 surveys with RDS Plus. So for a total of 2,000 surveys with both methodologies in each of the different countries. Let me go to the next slide. So what we believe, and it'll be good to hear if you believe the same thing as far as our hypothesized results, is that PBS-based sampling is easier to implement. It is more widely used and known. We have sampling frames to work from, and thus perhaps might be more efficient and less expensive. However, we do believe that it will likely underestimate the actual scale of the problem. Again, knocking on doors and you know, surveying either the head of household, or if we're lucky at getting the person who works within that sector, might not actually get at the true victims of the crime, which is what we're hoping that RDS Plus does allow us to do, knowing that it involves more steps and training and implementation, could be more laborious and perhaps more expensive, but we do believe that it will be the true population, the hidden population of those who are victims of both domestic servitude and exploitation within the fishing sector will be more, we'll be able to reach them better through social networks. And then the last slide. We had talked a little bit about the limitations. Again, sample will be limited if we're unable to access the work sites or living quarters for subject recruitment purposes. So this is a big piece of why the pilot study is important, is to be able to work out exactly who and what we'll be able to access and then adjust accordingly. And both PPS and RDS Plus may not get at those individuals, have restricted or no freedom of movement. And we will not capture those fishermen who are out to sea and those domestic workers who are working abroad at the time of data collection. That said, we're hoping that we will really learn a lot as to if both one or neither of these methodologies work at being able to estimate these two very vulnerable and sensitive populations in Costa Rica and Tanzania, and we'll be very excited to you know, share the results in 2 years' time. Obviously, COVID taking into account maybe some delays there. So thank you for your time, and I'm happy to answer any questions at the end of this.
Thank you so much, Dr. Dink. And next we will hear from Dr. Clifford Senes from NRC at the University of Chicago. Over to you, Dr. Senes.
Thank you very much. I am really privileged to be here. I don't have the same number of years, even if I look older, than working on this, but I hope my more diverse background in applications will compensate. I've already learned a lot from this series of presentations, and so my hat's off to University of Georgia, the Department of State, and APRIES, and all the panelists. I think there are a lot of synergies here that are going to happen, and I look forward to contributing to them and benefiting from them. Next slide. Next, yeah, okay. We have a fantastic team, as does each of the other grant recipients. In addition to the NRC at the University of Chicago, we have the University of Massachusetts at Lowell, and University Hassan II in Casablanca. And we're very privileged to be able to draw on the advice of the UN Office on Drugs and Crime. And of course, in addition to Professor Marji at Hassan II, we have additional local expertise. We have Association Beti, who specialize in providing services and understanding the forced labor, child labor, victimization in Morocco, and particularly in Casablanca. And finally, last but not least, we have Claire Vision Consulting, who will be doing our data collection. And we're quite happy to have these three Moroccan organizations to support this effort, because obviously context is everything. Next slide. Morocco, we all know that from North Africa, we have a tremendous amount of northward immigration into Europe, and that's caused a huge political issue. But Morocco also struggles from internal trafficking, mainly the young from rural areas into forced child domestic labor. And many of these children are trafficked into cities to serve as domestic workers known as les petites bonnes. An estimated, somewhat out of date and uncertain, a number of maybe 23,000 girls on the age of 18 are working as petite bonnes around Casablanca alone, nearly 60% under the age of 15. Morocco has been pressured internationally, and they've passed laws that have changed the minimum age of domestic worker to 18, but local organizations indicate that, in fact, domestic labor remains rampant. Next slide. However, there's little empirical research available about the complex relationships between irregular internally trafficked migrating populations and forced labor. Felicitously, we have, as we've heard, new state-of-the-art sampling and survey methods have been developed and applied to many policy questions related to hard-to-reach populations. And that NRC team is very hopeful that by applying these methods, they'll be able to develop independent, rigorous estimates of the true extent of the problem today in Morocco, using Casablanca as a metropolitan area to test out competing measurement approaches. Next slide. We are going to be using two primary sampling methods, time location sampling, and with venues, as we've heard a lot about these already, so I'm going to try to I'm going to free ride on my colleagues' better presentations of this than I could do. So I'll simply say that we'll use the TLS. We're going to go to bazaars, markets, parks, clinics, and the like, and all of those will be selected through rigorous methodology, which I won't go through, but it's analogous to what I believe Meredith, I think it was Meredith who presented. We're aiming to achieve a margin of error of less than 5%. I noticed another study doing about 19%. I hope that we can discuss further. I'm not sure how meaningful 19% is. And I think we might be able to consider thinking about ways of using common methodologies to determine the margins of error across these studies. We're going to then use RDS survey, which you apparently most of you know, of the petite bonne based on their social networks. I won't go into what RDS is, what's been done already, talked about already. And our instruments, the TLS and RDS instruments will incorporate an NSUM module. Now, so what that means is we'll be able to have basically three related estimates of prevalence. One from the TLS, which is somewhat, I'm going to call it the gold standard, even though it's not a household survey, but it is basically using the standard multi-stage probability proportional size sampling. Secondly, we'll get a prevalence estimate from the RDS survey. And then we'll get one from the NSUM, which will also provide us with counts, which we haven't really talked about. Another nice thing about combining these methods is that RDS will permit us the reciprocal measurement of the visibility of the petit bon. That is, finding out how the petit bon think others know about their status, what they think about this, whether they know their status. And as has been pointed out, this will allow us to do a generalized NSUM, which we hope will be which is supposed to be a less biased estimator than NSUM alone. Let's see, anything else I want to say here? Yeah, let's see. No, I guess let's go to the next slide. So again, with the idea of integrating and being coherent across our methodologies, we're going to use the RDS. The RDS seeds will come from the TLS interviews. So that since the TLS is going to generate already representative samples to begin with, we will already start, as I think Meredith mentioned also, our seeds will from the very beginning be representative, and we don't have to worry about an extended degree of rounds of RDS to achieve convergence to equilibrium, which by the way may still not be representative. We have more seeds, fewer waves. Again, which to my mind, the RDS is actually cheaper than the standard PPS sampling. I'll have to discuss with Meredith why she thinks it's the other way around. But I see, getting more seeds. Why didn't we just take all the seeds from TLS or forget about it, RDS? Well, it's because it's expensive. So, and also perhaps because we will be able to get those who we can actually find in market. So we're hoping RDS will actually achieve that. Let us get to places that we wouldn't, where the victims are actually unable to freely circulate. We will collect also respondent demographic information to do the network link tracing or RDS plus that we've heard. It seems that our teammate Steve Thompson, who's developed this, is as ubiquitous as Le Petit Bon. So he'll be obviously increasing the chances of us cross-fertilizing across teams. And the RDS Plus will increase estimator efficiency through resampling from the observed sample network that we get. And this will help better approximate the respondent selection probabilities. In other words, you need to know the probabilities of each respondent's chances of being in your sample to draw the correct inference. Next slide. Well, like everybody else, we're testing robustness of the prevalence estimates through multi-method comparisons, or very concerned about which ones turn out to be cost effective, because it's not just getting high precision, but at a cost that's worth it. If you just get a little more precision, but it costs double, that may not be very helpful. We also believe in what we call, we apply NRC defensive evaluation, where we're going to do defensive prevalence estimation, so that having multiple methods ensures that no single, if force majeure or we encounter a problem with one method, we will have the others available. Again, we have consistency across the various methods. So we're going to get the seeds, the RDS seeds from TLS, the NSUM interviews from TLS and RDS, and we will improve on NSUM by using the RDS to generalize to do the generalized NSUM. Next slide. Oh, I'm sorry. And one more. Next slide, please. The one other thing I want to say is that we're also testing our ability to transfer all this technology, all this statistical technology, to both the survey firm that we're working with, Claire Vision, and to our esteemed colleagues at University Hassan II, Dr. Mourji and Dr. Ezrari, and their research assistants. There are risks, and these are the ones that have been mentioned by the others. The high non-response rate, undercoverage, in this case, petit bon, if they don't go out, but we're hoping that the RDS will help us there. And of course, the sensitivity of the topic and legality means there may be a degree of false responses. We are going to test some list experiments to see whether or not they are at least can't reject the fact that we don't have those false responses. And therefore, as been said, we're going to do piloting and data collection. Let me see if I have any. There are a couple of points here that are probably off message, but I am very concerned with the ability of these studies to be externally valid, the external validity, the generalizability of these things. So we'll want to be working on that carefully. Also, the ambassador mentioned the importance of these studies in assessing impact of policies. I am also very concerned that that will not be possible in any direct way because of the lack of counterfactuals that we'll be generating here and the huge volatility and non-equilibrium situation with COVID. So we're going to be wanting to really figure out whether how we're going to be able to deal with that. So I guess with that, I'm going to thank everybody again for allowing us to participate in this. I think it's a fantastic opportunity, and I look forward not just to contributing, but to learning a lot. Thank you very much. Back to you, Lydia.
Thank you so much, Dr. Zenas. Next, we have Dr. Cortland Robinson from Johns Hopkins University.
Good day, everyone. Morning, afternoon, evening. Greetings to all our hosts, our colleagues, and guests attending this event. I'm very pleased and honored to be representing our project, and we'll introduce the study team just a little bit by photograph and background, and then talk a bit about our approach. We'll be estimating prevalence of trafficking into forced labor in the brick kiln industry in Pakistan. This is a collaborative effort involving Johns Hopkins Bloomberg School of Public Health, and that includes our Center for Humanitarian Health and our International Injury Research Unit, and then collaboration with Aga Khan University, their departments of community medicine and occupational health. So the next slide introduces our Hopkins team, and I won't go into all of the details, but my own work is involved in estimating many different characteristics of displaced migrant populations, including many affected by humanitarian crises, as well as estimating population size and other characteristics of hidden and hard to reach populations, mainly in Asia, but have done some work elsewhere, but primarily in Thailand, Myanmar, China, and Malaysia. I'll be project lead and PI for Hopkins. My colleague Abdul Bachani is at Johns Hopkins, heads the International Injury Research Unit, focuses on injuries and disabilities with extensive research on validating and estimating injury prevalence and disability, as well as promoting prevention in low resource settings in Africa and Asia. We're joined also by our colleague Nupa Zia, who is also on faculty at the International Injury Research Unit, and is an alum of Aga Khan University, with whom we've had many years of productive collaboration. So the next slide presents our AKU team. Dr. Zafar Fatmi comes from a background in community health, has done extensive work on measuring health and social determinants of various forms of labor and its risks and vulnerabilities. Dr. Asad Nafiz has worked with RDS, also measuring child labor, and Dr. Natasha Shaukat, also extensive work on occupational health and injury. And I think it's fair to say we bring a extensive clinical and public health perspective to this problem. And if I may say, we see trafficking along with its many other dimensions as a public health problem. And we hope to, along with the estimates of prevalence and risk, bring a closer focus on the kinds of injury and illness access to care, and other characteristics of vulnerability that being trafficked into forced labor convey. Next slide, please. Very quickly on the background and rationale, and these numbers are very conjectural and open to critique. 3.2 million victims of modern slavery, approximately 2.1 million working as bonded laborers, 20,000 brick kilns across the country, and possibly 4.5 million brick kiln workers, most of whom are estimated to have had some form of taken a loan, which then gets them into issues of debt bondage and other forms of exploitation. But there's obviously a need for further evidence to drive both the estimations of prevalence and out of those and risk factors out of those data to inform labor laws and monitor and evaluate impact of those laws and policies. In terms of our goals and objectives, the next slide, please. We are obviously aiming to generate evidence using 2 to 3, and I'll get to the possible 3, which we think we will do, but it was sort of a recent decision and discussion, and we're open to learning from our partners and colleagues in other projects to learn more about the NSUM method, but we'll be utilizing that along with 2 other methods I'll get to in a moment. So we want to answer 2 questions. What's the prevalence of trafficking into forced labor in the brick kiln industry in Sindh? We've selected only Sindh province for reasons of time and resources. There are brick kiln industries throughout the country, but we felt we needed to focus more intently on one area with whom we have AKU colleagues have extensive connections and contacts already, and then compare and contrast these sampling methodologies, which we'll be utilizing both to estimate prevalence, but also understand risk factors associated with forced labor, and of course compare and contrast not only results, but efficiencies, cost efficiencies included. So our study design is a mixed methods approach. We begin with community mapping, which is looking at work sites and worker populations in Sindh, as well as administrative data, and working with a variety of local community contacts and stakeholders to estimate what sorts of industries or work sites are in Sindh, what kinds of people are working at these sites, how variable are they in terms of size and characteristics, rural urban migrants. Some estimates suggest even long-staying Afghan refugees are working in some of these sites. So we have a maybe disparate population, and the community mapping and the qualitative research, in-depth interviews with brick kiln workers, and 25 key informant interviews with local national and international organizations will give us that context. And from that formative research, we then fine-tune and develop not only our questionnaires, but also be thinking more clearly, we hope, about where we will be sampling. We'll employ 2 approaches to conduct approximately 1,200 interviews. It could be slightly more, of children and adults working or currently or recently employed in brick kiln. And I mentioned recently because in other work we've done in labor trafficking, by interviewing some people who were former workers, we may get some information on people who were at one point trapped in work and unable to leave, who would be hard to reach in any survey, but have left and managed to stay alive and be around, and may give us information about experiences that are not current but recent. And this will be in a geographically stratified selection of areas in Sindh, Pakistan. The next slide shows our sampling methodology, and I again will piggyback on the presentations done earlier and not get into all of the ins and outs of RDS. We are anticipating 15 seeds, a representative sample drawn from across the different sort of categories of interest, up to 4 to 5 or 6 waves. We anticipate recruitment through cards or coupons and using a household survey. Again, we are very open and interested in hearing from people who are also working in this field and may have more expertise than we do. I've done a number of studies, as have our colleagues in AKU, but one can always learn. And I think it's a real strength of this project to have groups of experts available, not just within the studies, but available across the studies to continue to inform us teach us, and hopefully we may be able to contribute some learning as well. We'll also be using a multi-stage cluster random sampling approach, which in low resource settings and my work in humanitarian context, we generally use cluster random sampling with probability proportional to size, usually about a 30 by 20, 600 households is sufficient. But again, we're open to the dynamics of this particular population. And we'll be introducing a randomized design with probability proportional to the estimated size of the workers in given areas, and then stratifying those different sort of population densities, types of brick kiln work sites, and so forth to construct a stratified sample, and then using GPS to identify randomly populations of interest, i.e. households that include a current or former worker in the brick kiln industry. We've utilized this method in a number of studies among Myanmar migrant workers in Thailand, both in Nassau and in Samut Sakhon, as well as in studies of Myanmar survivors of forced marriage in China. The NSUM approach, I am a demographer by training, so I've done a number of different, used a number of different methods in estimating population size. This is not one of them, but we're very open to using this. We see some real benefit in embedding the NSUM or possibly generalized NSUM approaches and questions into the cluster sample survey, possibly the RDS as well. Again, we're very open to the possibilities there, but NSUM basically says, it asks the questions of how many X do you know, including populations or subpopulations of both known and unknown characteristics. So how many people do you know who are named Smith or Jones? Obviously the wrong last name to use in Pakistan, but I hope you take the point. And then questions about characteristics that may be lesser known, that it could include number of people working in brick kiln industries, number of people of other characteristics, and then one takes those and essentially analyzes network characteristics and applies those to estimate total population sizes. Next slide, please. In terms of our expected outcomes, I put this not as hypothesized results. We're somewhat agnostic. We see advantages and disadvantages of cluster randomized sampling with PPS as compared to RDS. There are benefits and one might say risks involved. Cost is one, training is another. I've never compared them head to head, and this is one of the great strengths, I think, of this approach. So rather than hypothesize is one better or worse than the other, I would suggest right now we're believing that, or hypothesizing that there are advantages and disadvantages to both of those, and some will help us with some additional estimator functions for population size. But at this point, what we hope to do is contribute to an understanding of the methodologies that are best suited to measure forced labor and hard to reach populations, contribute to the evidence based on prevalence of trafficking and forced labor and risks in the brick kiln industry, including occupational health risks. We have a lot, I think we can contribute to understanding, again, the health risks of being in forced labor and trafficked in particular. And again, to generate evidence to implement and monitor policies and programs to reduce prevalence of trafficking, not only for brick kiln workers in Sindh and in Pakistan, but we hope beyond. And our final slide is simply study challenges and limitations. This will be limited only to Sindh. Punjab is another area where there's extensive brick kiln work and likely the same or at least comparable dynamics. How far we can extend, extrapolate, and generalize is a question and a limit. Several people have noted that the pandemic brings many different complicating factors to us as researchers. One of them, of course, being what is happening or will happen to brick kiln work in Sindh as a result of the pandemic, whether that be employer policies or worker decisions about health and safety, or government policies about shutting down certain kinds of employment, stay-at-home policies, and the rest. So this is a great unknown and something we're going to have to explore in more detail. And of course, even without the pandemic, there are ethical issues involved in interviewing child laborers, marginalized populations, people who are stigmatized and vulnerable, and for whom answering sensitive questions may bring risk of upset, possibly re-triggering and re-traumatization, as well as, of course, risks of loss of confidentiality and privacy, which of course we take very seriously, along with the health and safety issues that COVID-19 presents. So we're in active discussions now with our colleagues at AKU, and we'll be discussing this with our ethical review boards at Johns Hopkins and AKU to make sure that we are operating consistently with best practice in the COVID-19 context, but also more broadly in the context of ethical conduct of research among these very vulnerable populations, and look forward to working with not only other study teams on this, but all of our many colleagues in this overall enterprise. So with that, I will say thank you. Very pleased to be here and presenting on behalf of my colleagues at Hopkins and AKU, and look forward to answering questions and answers and furthering this discussion. Thank you.
Thank you so much, Dr. Robinson. It's great to hear how the research teams are planning on implementing their design and considering the effects of COVID-19. And our last but not least, we have Dr. Sheldon Jean from the University of Massachusetts Lowell.
Thank you and hello. By now, you're probably tired of hearing words like sampling methodology, RDS, or multi-stage PPS. It's hard to find new things to say as the last project presenter, but I will try. First of all, I would like to thank the State Department and also the University of Georgia for funding these highly focused and finely crafted research projects. And again, this is truly unprecedented, both in terms of design requirements and the scale of the international collaboration. Frankly, and all of us have been very pleasantly surprised that a funding agency is so keen on promoting methodological rigors and pushing all of us to test and demonstrate different sampling strategies for prevalence estimation. Now, my project is entitled Estimating the Prevalence of Domestic Servitude in the City of Tunis, Tunisia. There are 3 partners in this project: the University of Massachusetts Lowell, my employer, the International Organization for Migration, Tunisia, and the John Jay College of Criminal Justice. Organizationally, next slide, please. This project consists of 2 teams. Our field team is led by Paola Pace and assisted by Iman Najai and Azuz Samri, all from the IOM. And our technical team is supported by Dr. Meredith Stank from John Jay College of Criminal Justice, Dr. Kyle Vinson, my long-term research partner on many projects, and Dr. Gabriela Sanchez from European University Institute, a country expert for Tunisia. Now, some background and rationale for our study. Next slide, please. Because of the different methods researchers have used to produce prevalence estimations, there have been many inconsistent numbers being thrown around. These different numbers have caused a lot of confusion as well as skepticism about the scope and the nature of human trafficking activities. There are essentially 2 major challenges in research on human trafficking. One is definitional, that is, what to count as human trafficking activities. I think many of us have struggled with this definitional challenge. And the other, of course, is what we're talking about today, is methodological. That is, how one go about collecting and analyzing data. Now, with these projects that we have talked about today, we hope to make significant progress in solving the methodological challenge. Next slide. Our project in Tunisia focuses on domestic servitude. Stories of domestic servitude in Tunisia are common, but empirical research on this topic is rare. According to IOM reports, the vast majority of domestic workers come from Côte d'Ivoire. In a recent study, IOM identified a total of 887 victims of human trafficking. 85% of them were victims of domestic servitude, and 86% of these identified victims were from Côte d'Ivoire. So domestic servitude is a pressing issue in Tunisia, but so far, most accounts of a domestic servitude are based on interviews with official stakeholders and members of non-governmental organizations, but not from the victims themselves or the women working in those households. There are two main objectives in this study. One, we want to compare two well-known sampling strategies for prevalence estimation. And two, we want to use this opportunity to train local researchers on how to implement the proposed sampling procedures. Now, for the purpose of comparison, our first sampling strategy is to use time and location of the sampling frame. You've heard about this many times today. And then applied a conventional multi-stage PPS sampling. As many presenters have stated, multi-stage PPS is used in most large-scale social surveys. Now, our decision to use time and location as the building blocks of a sampling frame is really driven by the subject population. It is simply impractical and even ethically challenging to conduct interviews at private residence where the questions are about the abuses that may be happening inside the house. Instead, we can only go to the locations such as churches and parks and the major thoroughfares where domestic servants congregate. Specifically, we will begin by constructing a comprehensive list of all such locations and times where domestic servants congregate throughout the city of Tunis. Our tentative plan is a 3-stage sampling procedure where all the neighborhoods where domestic servants are likely to be found will serve as our primary sampling unit. Next, with selected neighborhoods, we will draw a random sample of select specific locations where domestic servants congregate. And finally, we will apply a predetermined procedure to approach and recruit every 10th or 15th or 20th person at the location until we complete a predetermined number of interviews at that location. Our total sample size is budgeted for 1,000 for this sampling method. Our second sampling strategy is mark and recapture. Now, this is different from all the previous presentations you've heard. Mark recapture has been around for a long time. Biologists that developed this method to study hard-to-find wildlife. For a very long time, most statistical methods for estimating the size of hard-to-find populations relied on mark recapture techniques. Now, for this study, we're planning a 3-capture design. That is mark, recapture, and recapture. Our target sample size is 1,000. Now, specifically, we will deploy enumerators in pairs, aided by a visual grid and a clicker to count all the individuals present at a select venue. Then, following a random starting point, our enumerators will approach every 10th or 15th person until we complete a predetermined number of interviews for that location. Following the initial capture, the same paired enumerators will return to the same site the following week and repeat the same procedure. Now, this time they will be able to recognize if their selected person is someone they interviewed last time. Then, following the same procedure, a third recapture will take place the week after. Now, our hypotheses for this study are, sorry, I got this pop-up survey. Our hypotheses for this study are PPS-based sampling procedures are probably easier to implement because most people are familiar with it. But PPS-based sampling will likely underestimate the scale of the problem. On the other hand, mark recapture sampling requires more planning and training. Therefore, probably will be more difficult to implement and probably will be more expensive. But we hypothesize that mark recapture techniques are likely to be more precise for estimating the hidden population. Now, there's several limitations with both sampling strategies. Both prevalence estimation strategies will miss an unknown number of potential subjects, therefore victims, who do not frequent or rarely visit these locations where we do sampling. Now, those who are not free to leave their employers' houses will, of course, be systematically missed by both sampling strategies. However, at the minimum, we hope to test and compare these two sampling methods to determine their relative merits. And with that, I thank you for your attention.
Thank you so much, Dr. Grosjean. So this concludes the presentations from our research teams. And at this point, I will move to the next slide. So I know a lot of people have been asking questions and our panelists have been answering them. So thank you for that. We will now go ahead and read some of those and throw the questions out to our panelists. And we will also be looking on Twitter and Facebook. At this point, if our panelists could all turn their videos on so they're able to speak and address, would be great. And so I see that a lot of them have been answered, which is great. If I will start with the last one that I see, which has to do with COVID-19. So are any of the research teams considering making COVID-19 a primary focus of their research on prevalence? That is not just noting COVID as a factor that complicates findings, but studying how a global health pandemic alters the forms that prevalence might take.
So our team has discussed this, although of course things are evolving quite rapidly and we haven't made any official determination yet in terms of what our approach would be. But because we're focused on using a sequence of work histories covering a certain period of time in the recent past, the idea would be to look at, we had thought to use that to look at the seasonality of agriculture, but that would, because we would be covering before and immediately after COVID-19, we would be able to observe changes in prevalence of trafficking practices in response to the pandemic. Like when people do start to go back to work, or people who have been working through the pandemic, for example, we'd be able to make those comparisons by looking at those specific points in time.
Portland Robinson here. I can jump in. As a School of Public Health, we would be remiss if we didn't think about it very intently. I think that's an open question as to how we might capture information, even in the household surveys or whatever other methodologies we're using, to maybe ask some specific questions about, within the last year or whatever that date of first onset for cases in the countries of study. How has your experience, life changed? Whether it's a work stoppage, whether it's a move, whether it's a loss of a family member, and so forth. Once you go down that road, however, you're open to lots of more questions, and there's many different questions we're already seeking to answer. I think it's an important thing for us to think about as study teams, both individually and possibly more kind of collectively. Definitely is something we want to try to control for, is probably not the right word, but at least assess impact of during these studies.
This is Sheldon, if I may jump in. Yes, I agree with Cortland. Yeah, this pandemic is going to have a significant impact on our sampling strategies. Doesn't matter which one you're talking about, as long as the human interactions, as long as our survey requires human interactions, this pandemic will have an impact. But what I can see is this pandemic or the artifact will probably impact time location sampling more than the household-based sampling. And probably to some extent, the household-based sampling, which is something we're going to implement in Tanzania and Costa Rica, will probably to some extent benefit, if I may speculate, because you're more likely to find people inside the household than it is on the outside. Whereas our time location-based sampling counts on people hanging out in the parks, streets, and churches. These are precisely the locations that are shunned or discouraged by authorities. So for those of us who building time location-based sampling strategies, we have to probably think through on how that would impact our field activities.
This is Grant. I'd like to add one quick point. I agree with the implications both for sampling and for modality of data collection. Something I think is critical for us to all keep in mind as well is the importance of understanding the precise conditions of shutdown or opening up at the time in which we're collecting data from the standpoint of knowing what we're learning about a kind of out of equilibrium point in time. So there's supply and there's demand. You could imagine that during crisis for many poor households, but there may not be as many opportunities, for example, in work. You could imagine a time of open up. You could imagine that as a supply of work using trafficked labor, for example, grows, that with this sort of compounding of household crises has accumulated over time, you could see a real explosion in trafficking prevalence at a time of opening up. So I think really keeping in mind the precise details of what's happening in each location at the time of data collection is going to be key as well for trying to assess this.
Okay, any other panelists?
This is Meredith. I was just going to say something very quickly. I think what we're doing with a couple of other prevalence studies that we have ongoing at the moment in order to kind of get a sense of how things have also changed is asking questions of, you know, how many people within your network did you know, for example, were working in the fishing sector in a specific area prior to COVID, and then currently, assuming that we're going to be doing data collection after, you know, things start opening back up again. So it also will give you a sense, I think, of how much has changed. And what I had mentioned in my presentation is just just overall migration patterns might change as well. And the way we're gonna kind of learn more about that is asking questions of those who have stayed behind.
Thank you, Meredith.
And sorry, one thing to add from the Freedom Fund. So as part of our study, we will be actually partnering with a lot of public health NGOs. And I think one thing that we would just want to make sure is that we coordinate with them. There's loads of COVID research and surveys going on at the moment, and these people's time is also precious. So I think we want to make sure that, you know, if we are going to add more questions and to find out, you know, how they're responding and what the public health response has been, that we're also conscious that, you know, these are actually valuable and will be used by some other party.
Thank you, Yuki. We have a question about bias from the seeds. I believe this may be to NRC. Has the bias from the seeds eliminated with 3 waves of recruitment? Assuming there's some complex analysis procedure. This is from Dr. Lisa Johnston.
Sure. Can you hear me?
Yes.
You know, as economists like to say, that's an empirical question. But the theory that we're proposing is that TLS is going to generate within the limitations of TLS is going to generate a representative sample in general. So if we randomly select, perhaps according to certain characteristics in a stratified way, or through marginal stratification, if we select seeds in that way, then the seeds will have the properties of the sample, which was representative. So the reason, as I understand it, is, you know, seeds are from a costly procedure. RDS is much less expensive. And the reason is that you have a much higher rate of finding the right people, which you don't have all the time with the TLS. So by starting with representative sample of seeds, you don't need to go so far down the chains into doing so many waves of RDS. And the RDS anyway does not promise representativeness. It promises perhaps convergence to equilibrium, whatever that means. That said, we're hoping, and I'm not an expert in this area, that the link tracing, network link tracing that Steve is going to guide us on, is going to look at the integrity, through very computationally complex computer program, how to make a consistency across these network pieces which should improve or reduce bias. So again, fewer waves, greater number of seeds is the way to go, we believe.
Yeah,
Thank
so
you, Doctor.
ask perhaps Lisa and Katie to weigh in a little bit too, based on some of our discussions of this past week. Lisa and Katie, are you there?
Yes. Yeah. Well, first of all, I have an issue calling whatever that is RDS, because RDS is the whole principle. It's a first order Markov process, and the idea is to mitigate the biases in any type of snowball sample. So one way you mitigate biases is by getting far away from the seeds. And in TLS, you don't necessarily have a random sample of the population. You have a random, maybe you have some kind of random sample of the visible population. And visibility is a really big bottleneck in these populations as well, those who are visible and those who are not. So you're starting with a bottleneck anyway if you're selecting. I don't know if you want to do experimental things at this point. I know there's one or two articles, correct me if I'm wrong, by Thompson that's out describing this method. So I don't know if you want to do something so novel and so new instead of doing something that has been tested and tried over and over and over and over in many different populations. It's just
if I could quickly respond to that. Can you hear me, Lisa?
Yeah.
First of all, totally agree with you. But if the visibility is missing, then it's going to be missing in general. And so, RDS is not going to help us, because it's going to be, if we're assuming lack of observability of these populations, and I agree with you, it's a huge issue. And hopefully by piloting different protocols and ways of searching out, we will mitigate some of that.
Yeah.
That's number one. Number two, when you were saying about convergence again, I'm sorry, on Steve Thompson's network link protocol of tracing, that's ex post, okay?
Yeah.
That's done ex post. And what that means is if you don't like it, you don't have to use it. We will provide estimates with it and without it. And that's part of what I think APRIES and the State Department want. They want to road test some state-of-the-art innovation here, and we're doing so, and apparently so are some of the other projects, but without jeopardizing the more standard approaches, because this is going to be done ex post.
Thank you, Dr. I think we'll move on to the next question so we can get to more questions. We have one for any panelist. So in America, we know we have the big draw sports events that increase trafficking. Do you have the same types of things in your study areas, and how are those numbers going to be reflected? Any teams that have considered these big draw events? All right, so perhaps in the areas that you're going to be looking at specific geographic regions that may not have the big like Super Bowl events that we have, but that's definitely something to be mindful of. Another question is, most teams identified the limitation of missing those without freedom of movement, correct? What are the true implications for accuracy of prevalence estimations given this omission, when loss of freedom of movement is a common feature of trafficking in persons? And what's the best way to overcome this challenge of missing those that don't have freedom of movement?
So I think I've alluded to before, I think that maybe we should just all be honest and accept that we would never get a truly representative sample of a hidden population. I think that's just by the definition they are hidden. But I think that where we aren't able to access those isolated pockets, especially where people don't have freedom of movement, then we would end up getting an estimate that I would say is a conservative. It's an undercount of the number of victims and the deprivation that they suffer. So in that case, you know, from the Freedom Fund's perspective, that's still a useful estimate, because we would then say to policymakers or program designers to say, well, even though we know this is an undercount, actually, we still know that this problem exists and that this problem is sizable. And so, you know, I think that we just have to accept that, you know, this is not the true accurate picture, but that it still indicates that there is a problem that we need to take action on.
Risk of hogging the microphone, I'd second Yuki's point. I think two things. One can at least, this is not again a control or adjustment, but you can look at not only current but recent work, for example, and we did some of this work in Samutsakan in seafood processing as well as in MESOC. Have you recently worked in a particular sector where possibly these sort of so-called prison factories or really constraints on movement existed? It is going to be an undercount, but you can maybe at least explore some data from people who were recently in such a situation. If they reported having been constrained but somehow got freed, they paid their way out or they just escaped or what have you. The other, I think, is using formative research and just asking people, key informants who are knowledgeable, what do you think about sort of prevalence of really seriously constrained forms of work, as opposed to people who may be indebted and in other ways, in a sense, trapped, but the entrapment is more a threat of violence if they report this, as opposed to being physically unable to leave a site. But I agree. I think this is one of the things that challenges all of us. We're looking at populations who, many of whom simply cannot show up to speak. And I was talking with a Thai government official many years ago about trafficking, and he basically said, if they can show up to speak, they're not trafficked. And I thought, well, there's a conundrum, isn't it? You're probably measuring trafficking too strictly, but their idea is that you have to be essentially imprisoned in your work environment to truly be trafficked. If you can get out, that means you can leave, and if you're free to leave, then you're clearly not trafficked. So I use that just as an example of how we really need to understand this dynamic and do, I think, formative research and the best we can to estimate how that operates and what sort of modes and not probabilities, but sort of general prevalence of severely restricted movement as opposed to partially restricted movement over given periods of time and given contexts.
If I may say that we should not forget that GNSUM or NSUM in theory could count, obviously everything's an undercount probably, but could count some of these, in the case of les petites bonnes, for example, who are not going out very much or at all. Those could be counted in principle through the NSUM approach, because you're asking about acquaintances. You're not asking about acquaintances who go outside. And even if there is very limited, even if these people are trapped, if they're completely trapped, then yes, the NSUM was the only real option to get to them. But if they're not complete, if only the most difficult ones are trapped, then some of them will still be going out. And so the other techniques might, as you said, Portland, that there's some partial, and this is going to be an understatement, an underestimate, but I think we should remember about the NSUM option. Thank you.
If I may jump in, this is Sheldon from UMass Lowell. I want to concur with all the speakers who spoke before me, but one thing I do want to raise is that, yes, the word hidden population can mean two things. One is that is the question phrased, that total loss of freedom. And the other is that they're highly skewed in a population that defies conventional sampling strategy to reach them. Now, if the focus is on those who are entirely imprisoned or entrapped or enslaved and not free to move around, I think we all agree that no sampling strategies can reach that population. Even NSUM is very questionable. But on the other hand, I like to raise the question, the likelihood of entrapping or enslaving something deprive the entire freedom of individuals as an employment practice. For those of us who have done a lot of field work, you probably realize in a date of age where cheap labor is so abundant, to spend a lot of time and effort to enforce control mechanism in order to extract some cheap labor seems to me a rather extreme practice, labor practice. At the end of the day, labor trafficking, human trafficking it's all about exploitation. If I were an employer, there'll be plenty other ways to extract labor for exploitation for commercial purposes, as opposed to enslaving somebody. So I think it's likely, but it's not common form of a modern slavery. It's just my take on this.
Okay, I believe Deborah Arana would like to answer the previous question about the big draw events. So Deborah.
Yes, thank you, Lydia. About the big draw sports events, we have such situations here in Brazil as well. For example, in the World Cup and the Olympics, there was a lot of concern around the increase of child trafficking in those events. But not just the sports events. There's also events like Carnival and traditional parties that draw increased trafficking of children. In previous research, there has been specific questions about these movements of children. So I think it's an open question right now, if we can include that and how we can include that in the research. But just to know that there is a number of things that can actually draw changes in the movements, in the way that children are trafficked over time. So we will have to think about these issues in the design of the study.
Yeah, and I think when we design the study, we're making trade-offs. So the longer we have a reference period, then the longer we can capture those past events and maybe how that has involved new people getting involved in sex work. But I think then you're making that trade-off with like the ability of people to recall. And so that's always, I think the longer we can have a reference period, from our perspective, that you get a more accurate measure of prevalence, but then you're trading that off with people's memories. So I think, yeah, as Deborah said, I think we'll have to look at how we make those trade-offs.
Thank you, Deborah. So I think we only have time for one more question. Is there a particular question that anyone would like to answer in the Q&A or in the chat? And I know you've been doing a great job answering questions throughout this forum. But I'd like to throw it to anyone.
This is Grant. I saw a really interesting discussion. Sorry, I was late sort of catching up with what everyone was writing about cost effectiveness of different methodologies. I think that's a really important point. It probably merits a side discussion, but it seems like it could be a really important outcome that comes from all of this work as well. For people who are thinking about trade-offs and using different methods going forward, that's going to be a critical consideration.
This is Clifford. I would just like to weigh in by saying not to forget that it's not just precision, but it is also cost effectiveness that I think we have to be looking at. There's not always going to be a lot of State Department money available. And so we need to think about that. And secondly, I am concerned about, and this was raised earlier, about the external validity and the representative, how you're going to apply the generalizability of a particular study in one part of the country to another part of the country. And we need to think about that now when we're designing what sorts of covariate data we want to be collecting to encourage, and maybe the H2 HPMRG can help us think collectively about that. I will bring this up tomorrow in our private discussions. Thank you.
Those are good comments, especially the issue of cost effectiveness. That is something that we began a discussion, and we are going to follow up. That's a good question.
All right, now we're going to pass it over to Susan.
Hold on here. There we go. Hi, everyone again. I don't know about you, but I am.
Susan, just before you say something, sorry. I'm trying to ask Lisa and Katie and Ian to stay behind a little bit with Josh and Abby, maybe for 5 minutes. So Leah, do we have 5 minutes after one, or it all goes off?
Yeah, we can finish this first. And...
Okay, very good. Okay, sorry.
Great. So I don't know about you all who are still on here with us, but that was very impressive. So in closing, I just want to repeat what I said this morning, that we are so excited to embark on this project, to work with our incredibly talented partners, and to learn how better to measure hidden populations. And as I also mentioned, this event is just the start. We hope to check in now and again and hear about progress, initial lessons, and situations on the ground in the countries where we're working. And we want to thank you all for participating and supporting this important project. If anyone has further comments or questions, please send them to the APRIES at apries-web@uga.edu. And I think somebody should type that in probably into the comments so that everyone has it. But again, thank you very much. We're looking forward to seeing the results of this important project. Thank you.